I am a consultant obstetrician and gynaecologist because I believe passionately about empowering women about their bodies and their babies and their pregnancies and being able to make the right decisions for themselves. We've set up a few new services here at the Royal London to try and help with this. The first clinic that we've set up is a joint midwifery and obstetric birth options clinic. There was a midwifery-led birth options clinic running for quite a while, but it became really apparent that we needed obstetric involvement too.
At the Royal London, we've got two clinics that we use to support mothers. One is the birth options, which we provide for mothers during their pregnancy. And then there's the birth reflections, which we use to support mothers after they've had their babies. Both appointments for birth options and birth reflections are 1 hour appointments, which means that we're able to spend quality time with the women. We're able to give them all the information that they require. We're also able to have discussions on what other choices are available to them. So at the end of it, women feel really supported in their decision making. It helps us as well to be able to reflect as a service on the care that we're offering to women, and there are things that we have picked up from there to modify our services so that we're able to support women better in the future.
The idea for the virtual clinic came about because we had a system whereby all of the midwifery referrals to the consultant obstetric-led services were coming through in a big batch. So it was being done very rapidly and patients were being allocated to what people thought in a very short window of time was the most appropriate service for them to be referred to. And we felt that this could be done better with some allocated time and a senior clinician always looking through those referrals and really paying attention to them and digging back through the women's medical records. And we found that if we did it like that, then we could reduce referrals to the antenatal clinic services by about 30%, and also that we could really target services for the women who needed them.
Women with breech presentation were coming to a variety of antenatal clinics, and that meant that they weren't always getting the same standard of counselling and the same options given to them in terms of what their choices were.
We felt that we could safely manage these women in an outpatient setting, away from the labour ward, be as non-medicalised as we could, and that women would have the benefit of a relaxed experience. So here at the Royal London we support women to have an ECV, we'll support them if they choose an elective caesarean section, but importantly we'll also support them if they choose to have a vaginal breech delivery, and that's something that not every woman who comes through the service has experienced before.
Our patient satisfaction scores have improved substantially over the last 2 years. Complaints are down, governance is improving, so our safety has improved significantly, and all the feedback that we're getting from women is that our service is much more responsive to their needs. All these services have had a really positive knock-on effect because everybody knows that as a service we empower and want to support women in their choice, and that we really listen to what women want, and hopefully that's filtering into the whole community.